Hi, everyone. This is Janet Hill with the Rock Island County Health Department. Thank you for joining us today. It's 3:30 p.m. on March 4th, 2021. Today, we have with us Edward Rivers of the Scott County Health Department and Nita Ludwig of the Rock Island County Health Department. As always, please put your questions into the chat and please direct them to whichever panelist you would like to speak. First of all, Nita, let's start off with some Rock Island County numbers, please.
Sure. This afternoon, we have 19 new cases of COVID-19 to report, and that brings our total now to 12,924 total cases. We do not have any deaths to report today, and so our death total remains at 304 for our county, and 9 people are currently hospitalized in Rock Island County.
In Scott County, Iowa Department of Public Health reports 18,348 positive tests in Scott County and 211 deaths.
Okay, Janet, we'll go ahead and hear your prepared information for today's briefing. Nita, I'm sorry.
That's okay. As soon as the first COVID-19 vaccine shipments arrived in the Quad Cities back in December, we've asked for your patience and said that your time will come. Flash forward about 3 months later, and almost 30,000 people have gotten their first dose, and more than 9,000 people have received both doses. Now we've gotten word from the Illinois Department of Public Health that we could soon see up to 6,000 doses of the Johnson & Johnson vaccine coming into Rock Island County every week starting later this month. This is wonderful news for so many reasons. First, the Johnson & Johnson vaccine is a one-dose vaccine that offers 100% efficacy against severe illness and death after 49 days and 85% before that. Plus, we will continue to get regular and increasing shipments of both the Pfizer and Moderna vaccines in Rock Island County. More appointments are becoming available at our healthcare and pharmacy partners. For the first time since the pandemic began, we feel hopeful that the end is in sight. Vaccine supply is becoming more plentiful, but we are not to the point of offering consumer choice. You heard Scott County Medical Director Louis Katz say, which I think he will say, on Tuesday's media briefing, that he would take whichever vaccine is available to him, and you should do that too. Please listen to the medical experts and take the vaccine that is offered to you. Thank you.
Yesterday, Scott County hosted a vaccination clinic at our Sears site, and with the help of a number of community partners, we're able to vaccinate 1,170 people in the Phase 1B 65 and older priority population. The clinic was well run and moved us that much closer to a community protected from COVID-19. The extra allotment of Pfizer vaccine from the state of Iowa was received and administered within 2 days due to the process we have in place at Sears. We're hopeful that this additional vaccine in our community is a sign of better things and more vaccine to come. For many of you, your time to get the vaccine is coming closer. We encourage you to be ready to get the vaccine when it becomes available to you. Our website continues to have information on the various vaccines. Please visit for more information and frequently asked questions. As we continue to encourage eligible individuals to be vaccinated in our community, we ask that they be thoughtful as they schedule their appointments. Because the Johnson & Johnson vaccine has not yet made its way into Scott County, any vaccine you receive requires a second dose, 3 to 4 weeks after the first. So plan how you will receive that second dose by asking questions before you are vaccinated. This will be important in ensuring you get the full level of protection available by being fully vaccinated. On a personal note, this will be my last COVID Coalition press briefing. as I am retiring as of tomorrow, March 5th. It seems so very long ago, but it's actually 1 week short of a year since we had our first COVID press briefing on Friday the 13th in March 2020. Since that time, you, our media partners, have been a critical element in our pandemic response. You've ensured that the information about the risk of contracting COVID-19, interventions to prevent infection, and most recently, announcements about our vaccine clinics were communicated so the health and safety of our community were protected. Thank you for your attendance, participation, and support of our response. I would also like to thank the Scott County Board of Supervisors and the Scott County Board of Health. Throughout my tenure, and especially in the last year, they've enabled us to protect the community in ways that would not have been possible otherwise. This wholehearted support has benefited the community's health and safety immeasurably. Our community partners have also been a critical element in the department's success. The work of public health is eased when there are dedicated collaborators to ensure that access to medical services are available to all, population health programs are supported, and a community focus is employed regardless of physical or political boundaries. I've valued my time in the Quad Cities, and I'm sad to leave the friends I've made and relationships I've enjoyed. In parting, I bid you goodbye, good luck, wear a mask, avoid crowds, and wash your hands.
Thank you very much, Ed and Nita, for sharing your information today. And Ed, with your send off, we're wishing you well. We'll give a minute if our media partners have any questions for Ed or Nita. Dr. Katz is also on the call, should there be any questions for him as well. Okay, question here for Rock Island County. Today, Governor Pritzker spoke on the importance of messaging for those who might be hesitant to get the vaccine. Has the county health department focused on this type of messaging? And do you have any advice for someone who might be hesitant? We can start with Nita and Janet, and then Dr. Katz, if you'd like to chime in as well.
Sure. So we have just talked about this morning with a group that Janet, Brooke, and I were all speaking with. And they can certainly speak a little bit more to that. We have certainly shared any messages that we can about the safety and efficacy of all vaccines on our social media pages and on our website. And through these media briefings, and all of you, our partners, we have definitely tried to share and impress upon everyone that these vaccines are safe and effective. Janet, you can add into that if you wish.
We are also targeting, just a second here. We are also targeting African American and Hispanic communities because we know that those populations have been a little bit behind in our vaccination rate. So we have efforts in place, and we have fact sheets on togetherqc.com and our website and our Facebook pages to help you spread those words within your own communities.
Anything you'd like to add, Dr. Katz?
Well, it kind of varies whether it's one-on-one with a vaccine hesitant individual or if it's public messaging. But the bottom line, the things that I am asked about is whether the vaccine was rushed. That is not the case. It was, the vaccines came in a hurry because we dropped everything and funded the effort and did incredibly rigorous clinical trials for safety and efficacy. So that's an important message. And then beyond that, it's to convince people that COVID is important, and it's to now that we're starting to see some relaxation of CDC recommendations, the upside of being fully immunized is we're starting to back off on quarantine and isolation requirements, if you're exposed. And those benefits will accrue more and more as time goes on, and we expect CDC to say some more this week or next about things that can be relaxed. So there's a carrot and a stick, and the carrot is that you're going to be freer to be normal as more and more people are immunized.
Thank you all. We do hope to talk on this topic again on messaging for hesitant communities on upcoming briefings as we're having more of these discussions and more actions are taking place in the community. So please stay tuned for that as we share it. Again, as Janet mentioned, Together QC has some information and we'll be doing some as well from both of our health department sites. So please look for that to come soon. Another message, it says, thanks for everything, Ed. So we will go ahead and conclude our briefing for today. We wish Ed well in his retirement. And for the rest of us who aren't leaving as of tomorrow, we will be seeing you again next week on our briefing. Thank you again for all you're doing to support our efforts. And we wish you a good weekend and we'll talk to you next Tuesday.